Hello, I'd like to welcome you again. Thank you for coming. Can I just get a show of hands to see who has had experience with acupuncture in the past? Oh, so quite a few of you. Hopefully you'll learn a little bit more today. And what about acupressure? Have folks also experienced acupressure in the past? Okay, great. So as Dr. Brown mentioned, my name is Jonathan Simon. I'm an acupuncturist at the Integrative Medicine Center. I treat outpatients up at 74th Street at Bentheim Integrative Medicine Center, as well as at the Breast Center, at the Brooklyn Infusion Center, and as well as inpatients in the hospital. Today I'm going to give you a brief introduction to acupuncture. We'll cover some basic principles, both from a TCM, which is traditional Chinese medicine perspective, as well as from a biomedical perspective. We'll touch on some commonly treated conditions, both during cancer treatment as well as after cancer treatment. I'll touch briefly on research and safety issues, and then I'm going to teach you all some common acupressure techniques for self-care. So when someone comes for an acupuncture consult, there's very common questions that get asked, and some of them are here. Hopefully we'll cover them all today. If I don't cover them, I'll leave time for questions afterwards. Please don't be shy at the end. Let me know. People always want to know, what does acupuncture treat? Does it hurt? How does it work? How long do we retain the needles? What sensations may the patient experience, and how many treatments are required. So I'll touch on all of those later. All right. Acupuncture is a component of traditional Chinese medicine. Other aspects of traditional Chinese medicine are herbal therapy, as Dr. Bao mentioned, exercise, dietary recommendations, manipulation, such as Tui Na, which is a Chinese medical massage, moxa, which is a type of heat therapy, as well as cupping. In TCM, there's a specific emphasis placed on lifestyle changes and preventative care to promote health and well-being. It's also very much geared towards the individual. In its most basic form, acupuncture is the practice of inserting fine needles through the skin at specific points, especially to treat disease or relieve pain. In TCM, or traditional Chinese medicine, there's a focus on balancing the body. And there are meridians throughout the body which serve as channels for the flow of qi, or vital energy. Insertion of needles at defined points along these meridians regulate the flow of qi and result in clinical effects. In terms of how pain arises in TCM, it's thought to arise when there's an obstruction of free flow of qi within the channels, or the meridians. And by manipulating specific acupuncture points, you can restore the free flow of qi and relieve the pain. A little bit later, I'm going to give you the biomedical perspective on some of these ideas. This is the New Yorker's version from 2008 of Manhattan and the channels, or subway lines that flow through it. It's kind of a similar concept. In reality, the acupuncture channels are a little bit more complex. There are 14 main channels. There are 8 extraordinary channels, and about 300 to 500 points, depending on which source text you're looking at. So I want to discuss a little bit about acupuncture needles. As Dr. Bao mentioned, they're single-use sterile needles. They're categorized as medical devices. They're filiform, meaning they're meaning they're solid needles, not like hypodermic needles, which are hollow. And they're very, very thin. Acupuncture needles that we use range from 30 to 40 gauge. The higher the gauge number, the thinner the needle. So here you can compare it to a hypodermic needle on the left. You can actually put multiple acupuncture needles inside a hypodermic needle. That's called a penny, if anyone's curious. All right, so when the acupuncturist wants to needle a point, first they locate the point on the body. Then we use something called a guide tube, and the guide tube enables us to insert the needle very quickly, which makes it as painless as possible. Then the guide tube is removed from around the needle, and the needle is manipulated, often to try to get a chi sensation, which will be the sensation is often kind of an achy sensation. And it's not all points. There's actually only a few points that have them. But when we manipulate the needle, that's what we're trying to obtain. This is an image of a practitioner freehanding needles, though I believe all the practitioners here use tubes when performing acupuncture. So the needle insertions are often painless. I've actually treated a patient after telling them I was about to begin. I put in 8 needles, and the patient said, "Have we started yet?" And I said, "Yes, you have 8 needles in already." The needles are retained for 30 minutes. In the inpatient setting, the needles are retained for a shorter amount of time, but patients get treated more frequently. It's important to realize that the effects of acupuncture are cumulative, and you do often notice effects after the first treatment, but the effects build up with each treatment. A typical course of acupuncture is 6 to 8 weeks, and typically treatments are given once to twice a week. Now, the number of treatments and frequency varies based on the condition and the patient response and the presentation. All right. So from a biomedical viewpoint, you can't actually dissect meridians or find something called chi inside of the body, but there are a number of interesting theories about how you can map these concepts onto biomedical structures. This image shows acupuncture points located along fascial planes, myofascial planes, and it is often seen that the major acupuncture points are in areas where there's more connective tissue, which is what transmits the information to the nervous system. It's also been posited that the idea of chi is similar to the signaling framework, that exists in hormones and neurotransmitters and that sort of thing. So as Dr. Bell mentioned, the strongest mechanistic research comes from studying the nervous system. In terms of pain, acupuncture is known to stimulate the release of endogenous opioids. These are your body's natural painkillers, such as endorphins, enkephalins, and dynorphins. And scientific studies have demonstrated that acupuncture can induce analgesia, pain relief, but that these effects were blocked by naloxone, which is an opioid antagonist. So by binding to the receptors where these endogenous opioids would normally bind to, it blocks the effects of acupuncture. I wanted to include this slide on distal points. Patients often ask when we're treating dry mouth why we're putting needles in their hands, or sometimes we treat back pain and we're putting needles in their hands as well. And that's because studies have shown that needles inserted in one part of the body can affect other regions of the body. And that's also very common in the traditional Chinese medicine acupuncture theory. We did a study at MSK, fMRI study on xerostomia, and the point used for xerostomia is in your index finger, and it showed that that point increased blood flow and activity to the part of the brain involved in salivation production, saliva production. So needles aren't always put in the area of pain. These are some fMRI scans showing major acupuncture points and the either inhibition or stimulation at certain points of the brain. It's interesting to note the very commonly used points, such as stomach 36 on the bottom left there, and LI4 on the right, show the most activity in the brain scans. So most commonly we treat pain of many different types: post-surgical pain, incisional site pain, treatment-related arthralgias such as joint pain from aromatase inhibitors, And then we treat non-cancer related pain as well, back pain, sciatica, arthritis, etc. Acupuncture is very beneficial for the treatment of nausea and vomiting. A little bit later, I'm going to teach you some acupressure for a nausea and vomiting point. It can be very helpful for stress and anxiety, for hot flashes in both men and women. Lymphedema, we're actually on a phase 2 trial for lymphedema now, and I'll discuss that a little bit later in the research section. Dry mouth or xerostomia, and neuropathy, specifically chemo-induced peripheral neuropathy. It can be helpful with disturbed sleep and insomnia, GI dysfunction such as constipation and diarrhea, headaches, and I'll teach you an acupressure point for that a little bit later. And I think I mentioned back pain and arthritis already. Okay, I just want to touch briefly on the research and safety. This slide's a little bit out of date, but at the bottom it shows publications in acupuncture over roughly the last 20 years. And you can see in 2011 there were 1,352 publications on acupuncture. So the number is steadily growing in the research literature. Safety is obviously a big concern for many patients. Acupuncture is extremely safe. There are mild side effects. They're very rare. The common ones that we see are bruising, maybe pain at the incision site. That happens, like I said, rarely, but it also heals very quickly. A German study was done in 2004. They looked at over 97,000 patients. There were 760,000 total treatments, and of that treatment population, there were only 6 severe adverse effects. So that's a tiny, tiny fraction. And in the hands of trained practitioners, acupuncture is extremely safe. Again, here's some common side effects that are treated. The items at the top have the most literature support. As you move down, there's less support, although a lot of studies are still being done on lymphedema, for instance, neuropathy, etc. This is a screenshot from a meta-analysis looking at 11 trials on nausea, basically concluding that acupuncture can be a very beneficial option for managing nausea and chemo-induced nausea and vomiting. There was another trial done in 2010 on acupuncture versus venlafaxine, or Effexor, for the management of hot flashes in women, I believe on tamoxifen in this study. And so the acupuncture is the blue line there. The yellow line is the Effexor. And you can see actually post-treatment that the acupuncture had more long-lasting effects than the Effexor, and was also able, in the chart on the right, to reduce the severity as well. Not just the frequency, but also the severity. So we had a lymphedema pilot study that was published in 2011, and then a larger pilot study published in 2013 in the journal Cancer. We wanted to see if acupuncture, firstly, would be safe in the lymphedema population, and also was there potential benefit for reducing the arm circumference. So in the pilot study, we saw decreases in circumference compared to the unaffected arm in 31 of the 33 patients. In 11 patients, the decreases were over 30% between the affected and unaffected arm. There was no revision to pre-acupuncture circumference over time, and most importantly, there were no serious adverse effects. So in summary, the acupuncture was seen to be safe, well tolerated, and potentially able to decrease lymphedema. And currently, we're in the middle of a phase 2 randomized control trial looking at acupuncture and lymphedema in the breast cancer population. So if you go to About Herbs, which was the website that Simon Young created, you can search for acupuncture. And there's information for both practitioners and patients. And there's also a list of very well done studies that he cites on that page. So it's a great resource, a starting point. You can also go to cancer.gov, and they have a PDQ on acupuncture as well. That's helpful. So I'm going to teach you a few points of acupressure points for self-care. We're going to learn how to locate these points, and then it's important to apply firm and deep pressure to the point. Generally, we use our thumb or index finger to apply pressure in a circular motion. The stimulation will often elicit a nerve-like or achy sensation in the point. And typically for these points, you stimulate the point for 1 to 2 minutes, and then you switch to the other side, and you can repeat as often as needed. It's not possible to do too much. The first point I'd like us to look at is large intestine 4. This is the main headache point. It's also the most common point for generalized pain in the body. So I'm going to have you hold up your right hand, like the picture. The point is found in this V formed by the base of the index finger and the thumb. Unfortunately, the picture on the right is not that accurate. so listen to me. Then you're going to feel for the muscle belly. And the point is actually closer to the bone below the index finger. In the picture, they're pushing too close to the web of the hand, and we want to push in here. All right? And you use a circular motion like this with your thumb, and it's important to try to elicit that deep nerve-like sensation. Is anyone feeling that when you push there? Okay. Often when I teach people acupuncture in the hospital, and then I have them demonstrate on me, they're not using enough pressure. You obviously shouldn't be bruising yourself or drawing blood, but you need to use firm pressure on the points. All right? This next point is called PC6, and this is the main nausea point. It works for chemo-induced nausea. It works for nausea in general. And you're going to hold up your right hand with your thumb facing you. Mm-hmm. And then you're going to take 3 fingers from your left hand, the middle 3 fingers, and place them on the wrist crease of your right hand. And the purpose of this is to locate how far below the wrist crease the point is. That's the purpose of putting the 3 fingers there. And below your lowest finger, you're going to place your thumb between the 2 large tendons that you feel. Sometimes if you make a fist, it's easier, and I'll walk around, but sometimes if you make a fist, it's easier to see the 2 large tendons. And then using the same technique, you're going to use your thumb to apply pressure to this point. And again, put your fingers directly behind the point and back so you have a firm anchor to apply pressure. The tendons will be vertical when you're holding your hand like this. And I should also mention, with acupressure, the locations are a little bit more lenient than with acupuncture because you're using a larger surface of your thumb to apply pressure to the point. So what's most important is that you elicit these sensations, these achy sensations. If you're half an inch or an inch off the point, but you're still getting that sensation, you're probably getting the benefits you want. Oh, once you've thank you. Once you've actually located the point, you can put your hand open. And the handouts, this one says 2 to 3 minutes. which is great, but you can also do it for 1 minute, switch to the other hand, and keep going back and forth. This one is called yin tang. This is a point commonly used for anxiety and also relaxation. It's another one of the more commonly used acupuncture points. I find it easiest to stimulate this point using your thumb. So if you take your thumb, the point is located right between your eyebrows. And make sure you're using the pad of your thumb, this part. And you don't want to apply, you want to apply firm pressure here, but not too heavy. And there's actually been studies on this point in pediatric cancer patients for pre-procedure anxiety, and this point was shown to reduce anxiety in that population as well. You can also just apply direct pressure there, but I find circular motion is a little bit more soothing at that point. I do have this one last point, but it's going to be hard to locate because it's on the lower leg. This is I'll just talk about it briefly. This is a very common point used for fatigue as well as GI issues. It's called stomach 36. And the point is located, if people have questions about this, I'll answer them during the break. But the point is located below the eyes of the knee, and you use 4 fingers. If people want to learn this later, I'll show them, but it's a little bit more complex, especially with pants on. So in summary, acupuncture can be helpful for managing certain side effects related to chemo, radiation, and surgery. It's beneficial for pain and other non-cancer treatment-related conditions. Like I mentioned before, the effects of acupuncture are cumulative, and usually a course of treatment is required to address a condition. Research supports the safety of acupuncture when administered by trained professionals, and acupressure is safe and effective for self-care. Thank you very much. And here's that website again if anyone wants to write it down.